Hey guys, today we're doing an update on the COVID-19 virus. So obviously a lot has changed since we last talked. I know everybody has a lot of questions and it's always best to hear it straight from a doctor. If possible, one of the top doctors in America, never hurts, Dr. Russell Sidipane. All right, so we're gonna connect to him now. Please welcome Dr. Russell Sidipane, who is an allergist and immunologist and a clinical professor of medicine at the Alpert Medical School of Brown University. Welcome, doctor.
Glad to be here.
So today I wanted to go over with you a few common myths that are out there. I think there's some things people need clarification on. There's a lot of information out there, and I want to kind of consolidate what people really need to know and what they need to do in the coming weeks. So the first one is this a big deal or no? There are a lot of kids out there who are still on spring break and treating it like any other spring break and not taking any precautions whatsoever, still going to large parties, participating in large gatherings. So what do these people need to know? What do people need to do? What type of precautions should they be taking?
Well, it's critical at this time that we get the participation of the young people in this attempt to reduce the spread of the virus. As our chief of the infectious diseases at the NIH, Anthony Fauci, has requested it. He really needs every person, young and old, but particularly we're really counting on our youth to halt the spread, because as long as the virus can connect from person to person, it will exist in our community. And if people are getting together, it will keep existing for many, 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 many months. So if we can just separate, and even though it seems like, wow, how can I possibly catch something here? You can. Just being within 6 feet of another person is a risk factor if somebody has that infection. And so, yes, we need everybody. It's really a big deal to participate in this social distancing. Okay. Yeah. So we're trying to we want people to isolate, but not to necessarily be a complete and utter hermit. I mean, you definitely, if you live in a household, you want to interact with the people in your household. That's fine. It's interacting with all the other people in the world is where we have to limit. And so you want to try to avoid going to shopping at the grocery stores. You hate to be in crowds with other people. You really need to limit that type of exposure. But it's important that you stay connected to people, because, I mean, this can easily lead to anxiety and depression if you're just isolating yourself from any communication. So it's important that we keep our communications up, that we keep our spirits up, but that we limit our exposures to just a handful of the same people, so we can limit the spread of this infection.
Perfect. So yeah, there are a lot of things out there right now that are available to us to have social interaction without actually being in person. We have apps like Game Pigeon for iPhone users and Android users, where you could play card games and board games with your friends over your phone. We have obviously Skype and video calls that we can do to kind of see your friends without actually having to be in person with them. So there's a lot of stuff out there in this day and age where you can still interact from home.
Yeah, so I think there is a risk if you're going to work and exposed to lots of other people. You're going to be concerned, okay? But you can post signs outside your workplace. Do not come in if you have a cough, or if you've got even if you've got a new cold, because that could be the very first day of the coronavirus, and it may from there get more severe. So we really need to let other people know if we're working. Please don't come on in here and give us your infection. Additionally, if you're worried about how well that can be controlled, you can wear a mask in the workplace. To what effect it will have. I mean, certainly will have some benefit, but it'll also make other people aware that you're concerned about infection and that you want them to keep their distance as well. I think there's some things that the workplace can do to protect its employees, and I think the workplace, the employers need to really be paying close attention to these CDC recommendations and providing the safest possible workplace for their employees. Well, gloves are, depending on the type of work you're doing and what you're touching, that you really want to minimize how much you're touching things that other people are touching. And if that can't be avoided, for instance, if somebody is using the same doorknob all the time that other people are using, or we shouldn't be using the same pen or stylus ideally that other people are using. But if we are, you would say, wow, I should use a glove here, so that I can dispose of that after I handle that. So yeah, these things can help if contact is unavoidable.
How do I differentiate the cold versus coronavirus, or the flu versus coronavirus, or even now that we're entering to the season, allergies versus the coronavirus? What are some differentiating symptoms that people look out for?
Well, honestly, on day one, it's really hard to differentiate between all those episodes, all those conditions. And so when you're coming down with an illness, it's best that you stay home until you figure out what this is. Now, I'm going to give you some clues how to figure out what it is. But like I say, that may take a day or two to evolve. And the best thing to do during those first few days is to stay home and sort this out. If you're not sure, get some help call up and speak to your healthcare provider. Maybe they can help you. But certainly, the thing that's going on right now, the confusing thing, is that there's still a lot of colds going around at the same time that this coronavirus is happening. We also have influenza A and B still going around as well. And you have allergy symptoms. That we have the pollen season starting in many of particularly our southern states. We're getting tree pollen showing up in the air. So we can have respiratory symptoms for various reasons. If it's allergy, there should be some itching, particularly of the eyes and nose. And so if you have itchy eyes, that is the distinguishing feature that would suggest allergy. Whereas if you had body aches are more common in flus or coronavirus type thing. You could get some body aches with a cold, but usually nothing significant. When you have those really muscle pains, that's concerning. And fever is not, you don't see that with allergy, and you usually don't see that with a cold. So if you got fever, either you've got corona or you've got influenza. A distinguishing feature between corona and influenza may be more of the shortness of breath, and more of the cough, and more of the chest really filling up. If you have the worst chest cold of your life, and you can't recall your chest ever getting like this with a cold or a flu, probably there's a good chance it's something more than a cold or flu. So that's something to pay attention to.
That brings me to my last question. So say you are exhibiting some of these symptoms, you said call your healthcare provider. Is that your recommendation of what people should do? I know a lot of people are wondering, do I go into the doctor? Should I go to the hospital? Under what circumstances should I seek emergency care, or should I just be making a phone call?
Yeah, so this is the big challenge. So a lot of people don't have a healthcare provider they can call. Certainly a lot of our states, each state has a Department of Health hotline that patients can call if they've got questions, and there are very helpful people that can help provide some guidance as to what you might need to do or where you can get some help. What you don't want to do is just walk in, if you're sick, to walk into an urgent care center or just walk into an emergency room. You need to call ahead. Many of the urgent care centers aren't even equipped to see somebody who might have coronavirus, because in order to see patients who might have coronavirus, You have to have all this personal protective equipment that is above and beyond what is standard issue in most medical facilities. So most of these this type of protective equipment and garments that the healthcare provider would wear, you're only going to find really many times in the emergency room setting. So you could call up an urgent care center and say, look, I've got these symptoms. Is this something you can handle? And if they can, they will tell you that. But if not, they will tell you, please call the Department of Health. You might need to be screened and go to a drive-through screening. Or if you sound sick enough that you might need to go to the emergency room. If you're having shortness of breath, you probably need something more than just a screening for diagnosis. If you're short of breath, you probably need to call the emergency room and say, look, I've got this. Tell them you're coming. I've got the shortness of breath. I've had this cough. I've got a fever, and I'm coming in. And they will tell you where exactly to go, because they don't want you walking right through the front doors into the waiting room where everybody else is standing. They want you going through a specific entrance where there'll be people who are properly dressed to receive you and to care for you. So that's critical that people do that if they think they have the coronavirus.
Wow. Wow, that's very important information. I guess my only other question is there anything else you have to say to people out there during this time?
Oh, this is a difficult time. I don't think anybody in their lifetime in this country has gone through this type of process where we're all trying to reduce the spread of a very serious illness. Today in the news, we get the news of a family in New Jersey where 7 members of the family are infected with the coronavirus, and 3 members have already died. That message sends, it's a clear message that this is a very serious illness, and if we can stop the spread of it, we can literally save thousands of lives. So this is a big deal, and I think we all should just kind of do our part, do our job. Our job is to stay isolated, avoid crowds, and still enjoy life, but communicate through other mechanisms. And I think we'll all end up out of this on the other side in a lot better place if we do.
Thank you so much, Dr. Russell Sedipane. We appreciate your time. Have a great day.
Good luck to you and good health.
So to summarize Dr. Sedipane's points, number 1, is this serious? Yes, it's absolutely serious at this point. If you're still partying and going out on boats, going to beaches, gyms, anything that has more than 5 people in a place, you're exposing yourself to risk. It's not just about you. If you're young, you may not experience symptoms and you may just be a carrier of the virus, and you could spread it to people who really are at risk, like the elderly and people who are immunocompromised. Should I be in quarantine or isolation? At this point, it's actually recommended that if you can be in quarantine, that you do take that measure. As far as isolating yourself completely, you don't have to be a hermit. You can talk to your roommates, you can talk to your housemates, but you want to limit your contact and exposure to as many people as possible. Don't have large hangouts of friends, don't have game night. Should I go to work? Well, if you're not providing a crucial service like working at a hospital, a pharmacy, at this time, even working at a grocery store would be considered a crucial position, providing services to people so that we can access food. You have the right not to expose yourself to that risk. However, these are the positions where it would be appropriate to continue working. Will wearing gloves help me? Absolutely. This virus has been known to last on surfaces for multiple days. So if you're going to be touching a lot of surfaces, you should be using gloves, changing gloves appropriately. Try to limit touching as many surfaces as possible, whether wearing gloves or not. How do I know if I have COVID-19? Fever, shortness of breath. If you have either of those 2 symptoms, you should contact a doctor. State to state, they're going to give you different advice on where to go and what you should be doing. Let's say you know you're sick. What should you do? Reach out to a medical professional. Call ahead to make sure that the place you're going to go to is equipped to take care of you. So thank you guys for watching again. I hope I provided you some useful information. Remember, your only job right now is to prevent the spread of this virus. The growth is exponential, and the sooner we can reach the peak, then the sooner we're going to be down on the downswing. Experts are saying that as long as it took to reach the peak of this virus is how long it's going to take to completely eradicate it. So if we want things to go back to normal soon, everybody do your part. Don't spread the virus. Don't be selfish. Do your job.